The Autism Knowledge Gateway is a platform, and we're trying to promote that contains thousands and thousands of articles, peer-reviewed, on autism.
And the fact that you were so introduced so early in his experience to a medical issue almost sounds unique. It takes some of us a lot longer to see the pairing of the medical and the behavioral. So how did that happen so soon?
Hi there, I'm Casandra Oldham. Welcome to our first podcast of the Autism Knowledge Gateway, Conversations with Casandra. And today I'm here with Keri Schoenbrun, who will briefly tell you about herself.
Hi, Keri Schoenbrun. It's great to be here with you. I am a parent of two boys. My eldest is on the autism spectrum. He's 20 years old, and I had the privilege of meeting Casandra when he was about a year and a half, 2 years old, and we were very new as autism parents. And it's great to be here with you, Casandra, because we've been having these conversations for many years, and I think it's great to kind of make it formal and possible for other people to kind of be around the table with us and learn the things that we've been learning, for so long.
Yeah, thanks, Keri. And so the viewers know, you work for the Autism Knowledge Gateway as well. And that's why we're here together. I have three boys actually, the younger two, who have regressive autism and mitochondrial disease and a lot of other medically complex stuff, which we'll get to as we chat, who are now 20 and 18, and they have a birthday in September, so shortly that number is going to be changing.
It's hard to believe. It's hard to believe it's been that long since we started this journey, and I would say similar to you, in addition to my son's autism diagnosis, in our journey we've learned that he does have related health conditions that have been a really big part of our journey for him. Seizures, unexplainable seizures, have been a really difficult challenge for all of us in his ongoing development and safety, and so I think it's so important what we're trying to accomplish. And I guess maybe we should start with a little bit about the Autism Knowledge Gateway. You and I are pretty steeped in it. We've been working together for over a year on this really important project, but Casandra, why don't you start out by just kind of telling us how we got here, how this project became part of your life?
Right. The Autism Knowledge Gateway is it's a platform, and we're trying to promote that contains thousands and thousands of articles, peer-reviewed, on autism and its comorbidities and other challenges. There's lots of information out there that people aren't looking at. So Dr. Rosnell, my children's former doctor, he had compiled the library of thousands of articles and gave them to us to do this project with. My husband, Bill Oldham, has financed putting it together through his foundation and trying to make that information available for other parents and other practitioners. There's not a lot of practitioners that are skilled in being able to help people with autism and all of their underlying physiological issues that might accompany them. And we're trying to grow that population, and we're trying to get the science to other practitioners so that that can happen. And they can collaborate together on the platform as well. There's a practitioner portal, there's a parent portal, where they can each converse with each other to share knowledge and expertise in how to help people in our population. And so we're very fortunate to be able to provide that. The only reason we started it, if I talk about the background of my kids and the struggles, they're diagnosed with autism, and you've been through the diagnostic process too. Something's going on with your kid. You're a little unsure, but things aren't normal.
Yes.
And
Yes.
and for us, there was a developmental regression. So, it's like the kids are developing normal, and something happens, we went to our pediatrician. Pediatrician was like, take him to Kennedy Krieger in our area. That's kind of the best place to go at the time.
Yeah.
And pediatrician was like, it might be a language problem, speech delay. And we take him to Kennedy Krieger. You have to wait months to get in there. By the time we get in there, the autism diagnosis is a checklist of symptoms, all behavior based. So there's no underlying testing at that point except for Fragile X and a couple other genetic conditions that they knew about. So if you go in front of them and you have these checklist of symptoms, you get autism. We were left with a piece of paper with the Autism Speaks website on it and said, go home and Google these guys. I'm not even sure if Google was the thing back then. And, it might have been whatever search engine was there,
Yes,
AOL.
Exactly.
And,
It was that long ago, right?
Right, yeah. And get ABA. And I remember too, during the diagnosis, it was like, they're like, he needs SLP and he needs OT and he needs ABA and he has PDD-NOS. And I'm like, what does any of this mean? I turned to them and I was like, are you guys writing this down? Because I had no idea. And they were looking at me like it was really serious.
Yeah.
So I started Googling this stuff and autism kept popping up. But they didn't use the word autism in our diagnostic session. They used PDD-NOS, and it was
Same. And boy, was that confusing.
right. And I found out later, it was because I couldn't answer the questions adequately. Because they were like, does he point? And I'm like, yeah, he points. And they're like, well, does he point to share things? And joint attention is the phrase they use. And I was like, well, what's joint attention? Like, I hadn't heard that phrase before.
Such a good point, Cassandra. They expect us to understand these terms, right, which are really very specific to either medical or behavioral, and as if most parents wouldn't understand that unless they have that background. Yeah.
And then they were like, well, how many words does he say? And so we went home from that appointment. We had an appointment 2 weeks later at Kennedy Krieger or Children's Hospital, or maybe it was the other way around. They were 2 weeks apart anyways. And as we were writing down words that he was saying, and then we put a checklist by how often they'd say that word, he started losing words as we were writing them down. Like the regression continued over the 2 weeks. So
it's amazing you have that documented. It's incredible.
2 weeks later, when we went to the other appointment, I was better able to answer those questions because I had Googled or whatever the search engine was at the time, and educated myself and paid attention because I didn't know what to pay attention to before. I had no experience with autism. It wasn't as widely diagnosed then. I hadn't met anybody with autism, so but it was full out the second appointment. It was like, your son has autism. And so in that appointment, I heard it, and I heard it loud and clear. But there were no medical tests. It was, go for ABA and speech and language pathology, maybe some OT if he has sensory issues. Even then, I didn't understand sensory integration dysfunction at that point.
Not at all. It was so many different acronyms, and I don't know if you had this experience, but ABA was the first thing that was brought up to me. And when I looked around for providers, or I asked the people who are in our, world of advising us, some people were like, start immediately at 40 hours a week, and other people said it's barbaric. It was incredibly stressful as a parent to not have a definitive opinion about what the right course of action was. And to your point about medical, I've never left a doctor's office without some kind of follow-up action for a condition. And this was the first time someone dumped a diagnosis in my lap and just waved goodbye.
Oh, yeah. For us, I never heard ABA was barbaric from anybody. I heard ABA is the gold standard, and this is what you need to get done. I remember driving home from that appointment and not understanding what they said, but understanding the mood that had been in the room. And there was a magnitude, and a heaviness that I carried. And I started crying on the way home. And as I was crying on the way home, I still had a phone book. I started going through my phone book at the red lights and I started calling people. I started freaking out.
Yeah.
And something's wrong with my baby, you know? And the third person I called, so people didn't pick up, it was middle of the day. The
Right.
third person I phoned picked up, third or fifth, somewhere early on, but definitely not the first couple people I called. And she said to me, she goes, "Oh, I know somebody who teaches kids with autism. Let me give you her number."
Wow.
This woman that she connected me to happened to be a BCBA.
Wow. Okay.
Happened to get to my house 2 days later.
That's really, I mean, there's a lot of parts about your story that are difficult. I would say that's the one really lucky thing that happened to you.
For me, it was like, it was a God moment. Clearly, someone knew I could not handle anything more on my plate. I am going to help her out.
Yes. Call in
So
the cavalry and call in the right one.
Great. But there was no insurance, there was no coverage for it. It was very expensive. TRICARE was available for people in the military, which we were not. And so, the housing market had just crashed. We were upside down on our home. People before us and in our support group had gotten home equity loans. That's how they told us they paid for it. For us, we cashed in our 401ks, we cashed in our savings, and we got Gareth a home ABA program started pretty early. We couldn't get the 40 hours. We were trying to get as many hours, but we just couldn't find therapists to carry out all of that. So we gave him as much as we could until school started in September. He was diagnosed in May.
Okay.
And then, I thought we were doing okay. And 9 months later, I saw a shift in Corlin's attention.
And just to be clear, Corlin is your younger child, right? I don't know if we established the different experience that you had with both of your children so close in age.
Right. So Gareth got diagnosed. I knew there was something wrong. They're both born in September. The Christmas time when he was 2.
Okay.
And so Corlin was an infant still. And so the following December, I saw a shift in Corlin's attention. So he's just over 12, 14 months old. And I don't think I would have noticed it had I wouldn't have remembered Gareth had it had I not seen it in Corlin. And I was like, this is it. This is what happened just before Gareth regressed.
Wow.
So I call the doctor. I get in 3 weeks. They're like, we just got another doctor in here. He's not even booked up. Bring him in. So I bring him in early January. And he goes, oh, no. He's just delayed. He's not, he doesn't have autism. And I said, okay, so he's had a shift in his attention and he's not gaining at the same rate that his brother or that a normal kid would. This is what happened to his brother just before he regressed. And it was like, oh, you're paranoid, you're this, you're that. So 3 weeks later, after the Martin Luther King weekend, I remember this so vividly. It was
You do remember this well. I don't know if I could do that.
It's sketched in my mind. That weekend, we noticed he had stopped clapping, waving. He lost all language, babbling, responding to his name. There was just, I had a list of stuff. So I phoned Kennedy Krieger back up. Ended up, they said he was just in here for an evaluation. And I was insistent. So they said you can have a half an hour with the SLP that saw him 3 weeks ago. If she's concerned, then we'll be concerned. So I bring him back in, and she was with him for maybe 5 minutes, and she started crying. And she goes, I have heard people talk about this, but I have never seen it. And we were left in the room for about 20 minutes, and then the heavy hitters came in. And then we had all of these appointments, and they tested Corlin for stuff they never tested Gareth for. And that's when the screening for mitochondrial disease was done. So we got the phone call back to bring him. It ended up being Good Friday. And I remember that because they had an egg decorating contest in the lobby at Kennedy Krieger, and it was like bringing my bull into a china factory. Like my kid was like trying not to get those eggs broken on 12-hour testing,
Yeah.
because for the
That's insane.
yeah, the mitochondrial disease, they bring you in, and so we were positive for the screening. They bring you in, and there's a fasting and blood work and urine that are done every few hours. And it's very time specific. So you have to eat
Huh.
a meal that's high in protein and then wait 6 hours, and they do blood and urine, and then you have to eat something different, and they wait 4 or 8 hours or whatever it was, and then they do the blood and urine again. And so this went on, um, I think, over 12 hours. By the end of it, Corlin was strapped to a little cross,
My
and
gosh.
the veins were broken all in his hands and his feet because of the blood that they had already taken.
Yes.
And they were trying to suck blood through his femur, and only a physician can do that. The nurse can't do that. So we
Oh
had
my
we went
gosh.
to a doctor, and they're starting to suck the blood through the from the femur, and he's trying to cry and scream, and he has no tears and voice left, and it's just,
Ah.
I know, I was dying. I went running down into the bathroom and started um, kicking the garbage,
Yes, that's so
yelling at
painful.
God.
Oh my gosh.
And but he came out positive for mitochondrial disease. And then
Wow.
so they brought Gareth in, and they
Before you even get into Gareth, I just want to rewind because a lot of people don't know what mitochondrial disease is, and the fact that you were so introduced so early in his experience to a medical issue almost sounds unique. It takes some of us a lot longer to see
Right.
the pairing of the medical and the behavioral. So, like, how
Right.
did that happen so soon?
right. So I'll finish with Gareth, and then I'll come to that.
Yeah.
So they bring Gareth in. Gareth gets screened for mitochondrial disease, and he's positive. And because they saw how challenging it was for the child and for me, they said, based on the family history, based on his clinical past, based on positive for screening, we're not going to put him through that. We're just going to diagnose him with the same thing his brother has, because we're 99% certain this is what they've got. So
Wow.
I took biology in high school and university, and my undergrad's in kinesiology, so I knew what mitochondria was. Not everybody knows, and mitochondria is the powerhouse of the cell. So every cell in your body except for one cell, and I think it's white blood cells.
I can't remember, but I studied this recently with my son who's taking biology. He might
Okay,
remember.
so yeah, every cell in your body except for one type of cell, which I think is white blood cells, has mitochondria, and mitochondrial produces ATP, adenosine triphosphate, and that is the energy currency of the body. So everything that your body does needs ATP. It breaks that down, and it is produced in this thing called the Krebs cycle. And the Krebs cycle has a bunch of different steps to it. And depending on where that process is broken, it depends on what type of mitochondrial disease you can have. So during the 4 or 5 steps that the Krebs cycle is, it can be malfunction at step 1, step 2, step 3, or 1 and 3. There can be combinations of it. And for my kids, they had suspected type 1 and 3 because they were not able to tell us about some of the physical symptoms, which also helps a diagnosis as well. So that's why part of it is suspected. And what it does is it doesn't produce ATP efficiently and has an ammonia byproduct. And so the ammonia byproduct creates brain inflammation. It's toxic, right? And the brain inflammation creates seizures, and the seizures create developmental regression. So our job in getting a mitochondrial cocktail, which consists of coenzymes and antioxidants, not so much a pharmaceutical product, but compounded in such a way that it's used as a pharmaceutical product. But a lot of these are like a supplement you can get over the counter. But I wouldn't be able to get that into my kid unless I got it compounded the way we
Okay.
did. And it helps facilitate the Krebs cycle and then clean up that ammonia so that the brain damage can be kept at a minimum, stop the regression.
So describe what that was like. How long were they doing this cocktail before you saw benefit? How long did they have to stay on the cocktail? Like, how were you able to?
Well, and that's an interesting one too. So we had a pharmacist, a compounding pharmacy near us, and the woman who had started our support group had befriended the pharmacist.
Oh, I remember.
And so
Yeah.
Cindy, if you remember her, had
Yes.
befriended Lisa. And so I would go into the pharmacy, became familiar with the pharmacist, and she said to me one day, she goes, "What study are you in?" And I was like, "Study? We're not in a study." She goes, "Well, the way that they're increasing the levels every 2 weeks is not therapeutic dosing." And yeah, so I was like, "Ooh." So at that point, we had already started seeing Dr. Rosnell. And I phoned him and asked him to take over the mitochondrial cocktail from Kennedy Krieger and John Hopkins,
Okay.
and to give us therapeutic doses. And so, as soon as we got on a therapeutic dose, a lot of things changed. We also learned that mitochondrial can kind of disease can create some sort. They have to eat at certain intervals, and if you're not eating, the ammonia builds up too much. So, how to get my kids weren't sleeping through the night because they were waking up because of the ammonia byproduct. So we learned that if you put cornmeal in their bottle in the evening, because
Okay.
Colin was still on a bottle, I had breastfed him for the first year. He was
Okay.
diagnosed at about 14 months, 14, 15 months.
Okay.
We started putting cornmeal in his bottle, and he could sleep 7 hours sometimes.
Wow.
Freaking huge.
Huge.
So that combined with the mitochondrial cocktail really made a huge difference. And it made a
He was
difference.
able to eat in the proper increments because the way you bulked up his bottle and all of that.
Yeah, the cornstarch helps alleviate that stress of having to eat every 4 hours and
Okay.
extends it.
Okay.
At least when they were small, it did. They also went on a lactulose, which was a drug to help them have regular bowel movements. But as one of the things it also does is it regulates ammonia levels. So we were able to use it for two things.
Interesting.
And I
So
think
interesting.
that helped a lot too.
Interesting. I don't want to segue too fast, but if I were being honest with you, and I think some of our listeners might agree, you are very comfortable with medical things. Maybe it's your background in kinesiology, maybe it's all the experience you've had with your kids. This can be very overwhelming for a lot of parents who have different backgrounds and they rely on the medical system to help them understand these things. And maybe the medical system hasn't brought these things to light in a timely manner or at all. Help us understand a little bit about the experience that you had and why the Autism Knowledge Gateway became such an important project for you.
Right. There was many, many years where I couldn't tell the stories that I told you today without crying and losing it and talking through the tears. So the fact that I'm able to put into words without getting completely emotional.
I mean, that's a big accomplishment.
Yeah, and so I understood part of what I was being told as far as the science. I had basic science, it wasn't graduate degree, it was undergraduate on what mitochondrial was, but there was still a lot that was going on that was just really above my head. I knew there was no quiz, so I was able to understand what I could understand, write down notes, and take them to the pharmacist, take them to Dr. Rosnell, take them to Dr. Menon or some of the other doctors we were dealing with. Other parents who maybe did have a master's or a PhD. We come from a really well-educated area, so it's not hard to find a neighbor that, while you're out walking your dog,
That's right.
to help filter some of this stuff. Or I found the parent support groups really, really helpful too. We would talk each other through that. I also, and Cindy introduced us to this, found Taka. And Taka has parent mentoring. And that really helped a lot to, I don't want to say dumb down, but
Yeah.
to simplify at least some of the
Yeah.
knowledge that we were coming across as we tried to navigate what autism is. And I became manic. Um, I became panicked that someone said to me, time is of the essence. We have this
Yeah.
critical window of opportunity in order to reach our kid. And if you provide them with the adequate therapy, then they can become undistinguishable from their peers.
That was definitely the words back then.
I bought into that hook, line, and sinker.
Yeah. Yeah.
And I was so busy with the kids because I have 3 young boys at the time,
Yep.
and one who's neurotypical who did not ask for disabled brothers, and
That's
we're
right.
trying to keep everything as normal as we can for him,
Sure.
and then trying to hit the needs of the other 2 who are just being pulled in 2 different directions. And it was a lot. And I would stay up. I would try to go to bed, and I couldn't sleep. My mind would start to race, and so I would go downstairs. I think my husband might have thought I was having an affair. And I am just online researching and
Yeah.
researching and researching, and then researching what I'm researching.
Yes.
And
The rabbit holes and the connections. I mean, it could just take you all kinds of places.
right, and I come from the years of growing up where we had paper and pen, and so I've got this computer in front of me, and then I've got all of these papers everywhere with post-it notes and definitions, and
Yes.
it's like I was doing a research paper.
Yes.
And I would stay up for hours and only sleep for a few hours to try to learn and decipher what I could do next. And part of what I found was that a lot of these kids are physiologically sick. We were really lucky to get the mitochondrial disease diagnosis early, but
Yes.
there's a lot of kids that have these underlying issues. And trying to sift through what is snake oils and what is legitimate science. And, looking at the study, looking at who funds the study, who benefits from this study, how large was the study, asking all of the critical thinking skills.
Yes.
And then trying to finding out that my child probably has gut dysbiosis, which is a lot of people know what it means now, but imbalance in the gut. And
Yeah.
my child has yeast overgrowth, even
Okay.
though we haven't had this yeast test. And if I can just get a doctor to prescribe nystatin,
Yeah.
and then I'll be able to, heal their gut a little bit better with their diet, right? So I'm changing their diet, and I'm trying to ask a pediatrician to prescribe nystatin, and they don't want to prescribe it for me because
Yeah.
it's a medication. I really think that if the AKG was up and I was able to access some of these peer-reviewed articles that we have up there right now, and I don't have the Knowledge Gateway open right now, but I know that when you log in there, if you put nystatin in, we have hundreds of articles on
Right. Right.
that. And
I think it's worth you, just let's take a step back, okay, and remember what it's like to do all that research and then bring it into the doctor's office. Like, you really found something, right? And it's not always embraced. Talk about that, because I know we both have had some really hard conversations, and with respect to doctors, they're specialists in special things, right? And they may not necessarily be a specialist in the thing that you're bringing to them, and sometimes there's a disconnect. What are your thoughts there?
they're not. And back in the day, the gut-brain relationship was not known. And doctors really believed that I was a well-meaning mom who was grasping at straws, looking for something other than the fact that God gave me disabled kids. And God gave me 3 beautiful boys, the younger 2 who, had an attack on their immune system, which created brain inflammation, which created developmental regression, which created autistic symptoms. So they acquired their autism. So if you find out their physiology and how they acquired it, logic would tell you that
Yeah.
there's things that you can do to maybe not make them neurotypical the way that you get bought into with some of the ABA camp,
Yeah.
if you get that window of opportunity. But when I've treated their underlying physiological conditions, when we've tested for those,
Yes.
autistic symptoms have diminished or disappeared. They've moved further up the spectrum and less severe.
Okay.
So I would love the fact that that would become more well known. A lot of parents still to this day, they're like, it's genetic, you're born with it, don't try to fix me. And I think that's as absurd as saying your child's diagnosed with diabetes or cancer. Um, God gave that to you, and you should just accept that and not try to
Yeah.
change that. I'm not
Right.
trying to change my child, but if they're physiologically ill and
Yes.
there's something I can give them for them to
Yes.
be less ill and to function better daily, then
Yes.
I'm going to do that. I don't think I'm pulling at straws, but I remember walking into a doctor's office and saying, um, I'd like a stool analysis, or I'd like this and that. And he basically accused me of child abuse for wanting to put my kid through these medical tests. And they're not that
Wow.
invasive. There's nothing
Yeah.
child abuse about asking for a blood draw. Like, the kid's not going to like it. Most children don't like to
Right.
get poked. I know some
Right.
adults who don't like it.
I was going to say they don't let adults get away with saying they don't like it. So.
Right. So, but their reaction did not meet what I was pushing at, and it was really unfortunate. I learned pretty quickly that um, I was not going to be open with doctors who were not open with me, if that makes sense.
That's a great way to put it. Absolutely. And I think the thing you bring up that's so important is that doing intensive therapy and being healthy don't need to be mutually exclusive. Like for my own son, there would be times where he just wouldn't make progress and people are scratching their heads and they didn't know why, and he has the requisite skills to do X, Y, and Z. And looking back now, different medical profile, I think, than your kids, but he had some exceptionally intense anxiety that presented internally. And so it was not clear, but the level to which he was not coping in those therapeutic environments wasn't evident because he wasn't throwing tantrums, like he was just literally shutting down and withdrawing, and they just push and more. And I think if we had respected his body, his wiring, and his needs earlier on, he might have gained more from that therapy. And so I think what you're saying is so critical for any parent. There is no reason not to look at your child's health when you think about their overall well-being, right? And we get distracted from it based on the way people speak sometimes about autism intervention.
Right, right, absolutely. Um, I was, we had such a hard time potty training my youngest. And everybody's like, oh, he's not ready, and we're pushing and we're pushing. The technique that worked on Gareth wouldn't work on Corlin. And Corlin was pushing 5.5, and he still wasn't potty trained.
Okay.
So the ABA therapists got together, and some people had said, physiologically, he just probably is not there. And I was like, he's there physiologically. He just can't connect the fact. If he didn't understand spoken language, and he couldn't connect the fact of how do you teach an urge to
Right.
a child that doesn't get that?
Interesting.
So they had to get very angry at him, and he got scared into using the toilet.
Okay.
And it's probably not the nicest way to do potty training. But Corlin, where he lands on the spectrum, and he is way more comfortable in his skin than he used to be. He had a lot of self-injurious behaviors. He had been diagnosed, both my younger two had been diagnosed with something called PANDAS, pediatric autoimmune neuropsychotic disorder associated with streptococcal infection. what happens is if we get strep, we take antibiotics so that the strep virus doesn't harm our heart.
Yeah.
With them, they got strep. They weren't able to tell us they had strep, and because they're nonverbal, so the strep goes to the basic ganglia of the brain and creates OCD, tics, aggression, psychotic episodes. For us, it appeared as self-injurious behavior, and so he's dealing with all of this while trying to potty train as well.
I
And
mean, it's
yeah,
impossible.
it was just crazy. So we got them IVIG, and one treatment of IVIG, and my youngest child's psychotic episodes disappeared.
Wow. I mean, again, I think this is where we have to pause and bring it back to the Autism Knowledge Gateway. It's such a perfect example. Pandas, there's incredible, I should say credible research coming out of NIH however many years ago with Dr. Sweeto, but not every doctor who's working with our kids knows about it, understands it, and so it does get missed. And for kids who are being asked to do so much and work so hard, if this is something that they are encumbered with, we need to know, right?
Oh, absolutely. And there's people that say that that's controversial. Pandas is controversial. And it's like, no, it isn't. You have the symptoms and you have a blood test. The ASO and the anti-DNase titers, those together will tell you whether you have pandas. And the fact that after one IVIG treatment with both my boys, both of them left the doctor's office a completely different child than they walked in. Now, did they still have autism? Yeah. But would you take away the self-injurious behavior, the aggression, the psychotic episodes in a few hours?
Yeah.
It was life-changing.
Wow. I mean, describe that more. I think that that's incredible. I mean, if you remember enough, like the things that they were able to do or interact with after that IVI treatment that maybe they weren't before. I mean, the potty train's a great example.
We had to take the plane down to Dr. Rosnell. We were going to do the first IVIG treatment in his office in case there's any side effects. So we roll into his office, and if anybody has ever heard of him or knows his office, he has 2 young boys with autism as well. And he thinks of stuff as a doctor, and then he also thinks of stuff as a parent. So it's like no other doctor experience. And you roll in there, and it's like, if anybody else getting an IVIG, you're going to tether a child to an IV pole. You go into Dr. Rosnell's office, and they have the IV pump in a little backpack. And they put the IV in, and they wrap the arm out so the kid can't just pull it out. And they're able to kind of go around the office. Well, we're on the plane on the way there. Corlin hadn't worn shoes for maybe 7 months. And he just couldn't stand them on his feet at all. We're walking through the airport. I've got Gareth, so we divide and conquer. Bill's got Corlin. And it's a very busy airport, and we're landing in Orlando, and we're going down to the baggage check, and a bunch of people are in between us. So you can't readily see that we're together.
Yeah.
And so I'm about 5 people behind him on the escalator, and I can hear these ladies right in front of me go, "Did you see that man with that boy? And that little boy has no shoes on. What a horrible parent he is." And they're saying all these awful things about my husband.
Oh, Cassandra, that's awful to hear, but you know what?
Coming out of my ears. And so I get off the escalator. I'm like, "Bill, wait up." And then we're together. I give him a scowl. But we got that a lot. And so it's just, he went and he had his IVIG treatment, and he got disconnected from the IV, and they took the backpack off, and he went over to the corner, and that child put on his shoes.
Wow.
Like, it was just,
That's incredible.
yeah, it was over, and it was just, it's something so small, but it's something so big all at the same time. And
It is something that an autism parent could fully understand the gravity of in ways that maybe somebody else couldn't, but that is big.
he always had shoes with us, but they were never on his feet. And he went over and put those freaking shoes on. And I felt the earth move and the heavens opened up. It was a big deal.
That's a big deal. That's a big deal. And again, this is research that exists, right? Like, this was not you seeking out a snake oil treatment.
Oh, yeah.
And the Autism Knowledge Gateway is really intended to house research that has been peer reviewed, proven, but maybe just not, known by the masses, right? But if it's something that's important to your kid, it's the most important piece of research, right? And so making those connections, not just for families, but for doctors as well, this is really what this is about, right?
Right, right. And so when we got home, we continued to take data. ABA therapists, as you know, are incredibly great about taking data throughout the sessions. And he had zero self-harming behavior. Like zero. He went from all the time to none, one treatment. And so then we got subsequent treatments up here in Northern Virginia at our local hospital after jumping through some hoops. And so we did that for 5 more months. They had 6 months worth of IVIG treatments. And yeah, then the Autism Knowledge Gateway has a lot of information on that. And a lot of children acquire this and it's misdiagnosed. So if you look at the symptoms, you look how to test it, and clinicians and parents, hopefully we can get help for these kids because it is treatable. That one, so huge.
That is huge. I mean, it must have changed their interactions. I mean, you're not in pain or you're not having psychoses. I mean, how does that not change everything about your life, right?
Exactly.
And yours as well, right? I mean, I imagine that your experience, the pressure that you lived with, like, it doesn't go away, but it must feel a lot more manageable when you're feeling better in your own skin.
Autism and aggression go hand in hand sometimes. And, there's a whole subset of kids that I believe, and my experience is, the aggression comes when there's 2 things present. Pain that you're not able to verbalize, and frustration from not being able to communicate. So for me, they don't just come out of nowhere. Aggression also came, and we've talked about this a couple times, from low cholesterol levels.
A great example to share.
Yeah, and that was one that I didn't know about beforehand. So Dr. Rosnell was fabulous about doing underlying testing and testing for a variety of things that he had learned about from peer-reviewed articles on PubMed that he would then gather, and that's our library. So he knew, he had seen an article and he had seen the research that was low cholesterol can cause aggression. And so he started testing more of his patients who exhibited aggressive symptoms for their cholesterol levels. And my children, and the height of their aggression, came up low for cholesterol. So he's like, we're going to put them on sonic cholesterol. I'm like, what? Cholesterol's bad. You're supposed to stay away from this. And so he was so great, still is. But so he prints off the article so I can inform myself too.
Yeah.
And this article in particular is in the Autism Knowledge Gateway. And I'm like, oh, so this is why you would give somebody cholesterol. And put the kids on cholesterol increasing medications, and their aggression went down.
Wow.
So
I mean, just the knowledge that cholesterol being low has an impact on their well-being and behavior is fairly groundbreaking in terms of average knowledge, right? I think if you quizzed a bunch of doctors who didn't live in this world, that would not be like a natural assumption that they would have, right? And so it once again points to the fact that this is about your kid, your experience, and the research that exists to surround them, right? And if it was easy and everybody knew it, we wouldn't be here. There wouldn't be an Autism Knowledge Gateway.
Right.
But right now it isn't easy, right?
People also don't put it, and I alluded to it beforehand, but enough emphasis on diet and behavior, and diet and brain. We're better now than we were 20 years ago when my children were getting diagnosed. But even GI doctors now, they'll prescribe medication without prescribing diet changes, which just really blows my mind.
It seems like it shouldn't have been groundbreaking, right? It makes a lot of sense.
I mean, when we were growing up, people were like, oh, don't give them sugar because then they'll be flying off the ceiling. So we're okay at believing that sugar is going to do that, but we're not going to believe that all of these other things can affect behavior as well.
And it might affect one person differently than another. Just because you can tolerate it doesn't mean somebody else can. And if they're suffering, it's worth a look, right?
Absolutely.
There's so much that we can get into, but I think your story is so amazing that I don't want to run out of time before you kind of fast forward. Tell us where you are now, how your boys are doing, and, what does the struggles look like now? Like how have you been able to improve the medical piece, and where is your focus now?
Right. So my kids never became undistinguishable from their peers, no matter how much ABA, and we gave them a lot of ABA. I think at one point it was up to 70 hours a week. And we did biomedical intervention as well, which means testing for the underlying physiological conditions that may be present, and then treating accordingly. And they had some big wows for us, like the IVIG and the better behavior. My boys are comfortable in their skin, and that's a huge deal.
It's a huge deal.
They've had consistent, constant support that is adequate for their needs for an extended period of time. So their behaviors are very good right now too, and they progress on their goals. My youngest is still nonverbal. My middle child is minimally verbal. They are learning to spell. There's a huge move, and I hopefully will do another podcast, and I won't go too in depth into that.
Yeah.
But basically, they spell to communicate, and that's still an emerging skill. But the more they can communicate, the lower the behaviors become, because there's less frustration. And we all have behaviors, the neurotypical people, when
Oh yeah.
they're not communicating effectively. So why would it be
Yes.
any different with them?
Yes.
But the big, huge thing is that they can sleep through the night, that they're not hurting themselves or other people, and they have adequate support. So that's the big one for us right now.
Yeah. I think it's such a big deal. I know you do. I speak to a number of parents that struggle with some pretty significant things right now that to me sound like a person not comfortable in their own skin. And I just want to emphasize that if this is not an avenue they've gone down, the benefit of just getting to know their child in this way, at this level, through this kind of research, so nothing's missed. I mean, that's kind of our hope as parents, right, is that we're turning over every rock.
Exactly.
With that, is there a parting message that you kind of want to give to any of the listeners now that you've kind of described a little bit about your journey?
Right. So, if you're a parent and you have a child and you decide to go down this avenue to try to figure out where your child may be lacking and what the underlying physiological issues they might have can be, it can be a little overwhelming. And I tell people, particularly, let's use the diet as an example. We went into one doctor before we hit Dr. Rosnell, and he's like, you need to go on an SCD diet and specific carbohydrate diet. And so you start looking at what you can eat and what you've been feeding your child, and there's nothing you've been feeding your child hardly that's on that list of what you're eating. And you've got these picky eaters, and most parents find it completely overwhelming. For me, when I started to look at what I could feed my children rather than what I could not feed my children,
Okay.
the world started to open up. When I focus on what you can do rather than what you can't do. It's like, okay, we can eat chicken, we can eat pears, we can eat, and I started to list there's probably 12 foods we could eat for a little while. And as the gut healed, we were able to expand that. But when I was like, okay, they can't have gluten, and they can't have bread, and they can't have bananas, and they can't have apples, and they can't have all of these things, then it makes it really difficult. But, my kids could eat nuts, so we made nut flours.
Okay.
And they didn't have these gluten-free sections, and I think some
We
of
had
it's
nothing.
processed too. So just because it's gluten-free doesn't mean it's organic or healthy.
Right.
So a lot of our food, we had to get creative, and thank goodness for the internet. So I always tell parents, focus on what you can do rather than what you can't do, and reach out to other parent support groups. Parent support groups will give you tips and tricks, and suggestions that you just won't get anywhere else.
And really help you reduce the time from question to answer. I mean, I think that's one of the most impactful things in our history in our relationship is when I had a question, I'd call you first because I knew how much you knew and researched and all of that. And, you know, for any parent, if you can get to answers faster, obviously that's what we want to do.
That's right. That's right.